Something that'll make a noise. This hearing will come to order. Glad to welcome everyone here today. Appreciate everyone's interest in this important topic. This hearing today will address improper payments made by the federal government and will continue this subcommittee's examination of federal financial management issues. In fiscal year 2011, the federal government reported $115 billion in improper payments. We know that this is only an estimate and that the total amount of improper payments is unknown and likely even higher. Improper payments occur for a variety of reasons, but they are the result of poor financial management. Programs are particularly vulnerable to improper payments when agencies fail to maintain effective internal controls, adequate financial management systems, or insufficient oversight. These programs are classified as high error. In fiscal year 2011, the Office of Management and Budget identified 11 high error programs. These 11 programs made up 94% of all improper payments identified in 2011. At the top of the list are Medicare and Medicaid programs, which account for over half of all reported improper payments. Other high error programs include unemployment insurance, Social Security, and the Earned Income Tax Credit. Some of these high error programs are uniquely challenged due to the large budgetary obligations. However, they all share similar problems of ineffective internal controls. In order to reduce improper payments, agencies must reevaluate their internal control structures and increase accountability in program management. There must also be more effort to ensure that agencies report their improper payments. Although not all agencies are required to report such improper payment estimates, some agencies that are required to do so are failing to do so. The most significant agency failing to report is the Department of Defense. Although both the Government Accountability Office and the Defense Office of Inspector General have found that the Department is at a high risk for improper payments. Over the past decade, there has been significant work by both President Bush and his administration and President Obama and his administration to reduce and prevent improper payments. While some agencies have made progress in identifying and reducing improper payments in certain programs, many of the agencies still lack the necessary framework of internal controls that could lead to a sustainable decrease in such payments. It is clear that better solutions are needed to protect taxpayer dollars and bring accountability to federal spending. An increased focus on preventative controls would allow agencies to stop more improper payments before they are issued. Better detection methods would also help prevent and recover more payments. Most importantly, the government must do a better job at identifying the root causes of improper payments. Until we understand how and why these payments are being made, it will be impossible to effectively prevent them. Billions of taxpayer dollars are misspent every year through improper payments. This administration and agency leaders have made significant efforts to reduce these payments, and their work is both important and commendable. However, we need more solutions to better protect taxpayer funding. We are honored to be joined here today by Senator Carper to discuss a bill currently being considered to help reduce improper payments. We will also hear from witnesses on the problems that lead to improper payments and what we can do to prevent them. We certainly are grateful for each of the witnesses who will share their expertise and knowledge with us here today and look forward to their testimony. I'm now honored to recognize the ranking member, the former chairman of the full committee, Mr. Towns from New York, for the purpose of an opening statement.
Thank you very much, Mr. Chairman. I'm pleased that we are continuing to examine the progress we have made in reducing improper payments and also the challenge which remains. I would like to welcome Senator Carper, that dedicated and committed and tireless champion of good government in the other chamber. It is my hope that we can work closely together on our proposal to build a bridge between where we are now and the elimination of improper payments in the future. Mr. Werfel, it's good to see you again. Ms. Davis and Mr. Wood, welcome, and I look forward to your testimony. The Obama administration has put forth very robust initiatives to eliminate improper payments, which is one of the key components of the President's effort to eliminate waste in government. I am encouraged that we have seen some positive results. In fiscal year 2011, the federal government shrank the amount of improper payments by 4.7%, or $5.3 billion, compared to the prior year. While this is a significant accomplishment, the level of improper payments is still unacceptably high. Some of the initiatives responsible for the drop in improper payments include the Do Not Pay list, which the President called for in June of 2010 in order to prevent ineligible recipients from being paid repeatedly. The VerifyPayments.gov website was created to enhance this effort. We will hear from Senator Carper today about a legislative fix that would make checking the Do Not Pay list the law of the land. The President also asked agencies to be transparent about the amount of improper payments and to account to the American public for their actions in addressing the problem. I am pleased that the PaymentAccuracy.gov website has been up and running and shows that exact information, which is also a great response. President Obama expanded the use of payment recapture audits as a way of detecting payment errors and recovering improper overpayments. Since 2010, agencies have recaptured nearly $1.9 billion in improper payments for our Treasury. Once again, we look forward to hearing Senator Carper's proposal on how to improve on this initiative. A healthy financial future for the United States requires sustained effort from more than one source. We have to watch what we spend, get rid of the waste, increase revenue, and reduce improper payments, all at the same time to accomplish this goal. Our witnesses are the professionals in our government, dedicated to achieving all of these goals. They will explain our gains, our challenges, and propose solutions that will keep us on the path to eliminating waste in our government. I'm looking forward to working on from in a bipartisan way to reducing the cap and capturing the improper payments. Thank you very much, Mr. Chairman. On that note, I yield back, and I'm anxious to hear the senator from the other side.
Thank the gentleman, and certainly echo Mr. Townsend's comments of working on this issue in a bipartisan and bicameral manner, because it is truly about protecting taxpayers' hard-earned dollars. We will have the record open for 7 days for other members who want to submit a statement, opening statement, or extraneous material for the record. We are honored to have the senior senator from Delaware, the Honorable Thomas R. Carper, also chairman of the Subcommittee on Federal Financial Management, Government Information, Federal Services, and International Security on the Senate Homeland Security and Government Affairs Committee. And Senator, I thought I had a committee with a long title, but I think you've outdone me. So, and I should say, Mr. Chairman, we really appreciate your efforts. You've been a longtime leader on government reform issues, and especially here about protecting taxpayer funds. And not only do we look forward to working with you, but we're honored to have you here to share your insights about the legislation you've introduced. So without further ado, Mr. Chairman, the floor is yours.
Thanks, Chairman Platts, and to you, to my compadre and friend for many years, Ed Towns. He and I came together, as I mentioned to you earlier. We came together to the Congress in 1982 when we're about to run out of money in Social Security, and not reduce payments, but literally in 1983 run out of money entirely. And we had a Republican president, Ronald Reagan, Democratic Speaker of the House, Tip O'Neill, and a lot of Democrats and Republicans here who went to work and used as a blueprint the commission led by Alan Greenspan, and came up and solved the problem, not forever, but for another 25 or 30 years, put Social Security in a pretty good path and track. And but it was that bipartisan spirit, House and Senate working together, legislative, executive branch, with some really smart people who joined Alan Greenspan. And I come to you in the spirit, that same spirit, that led us to that success in '82 and '83, and hopefully we could rekindle that here today. But I thank you very much for the chance to come by and to revisit these old haunts. and to have a chance to see both of you, too. As everyone in this room knows, we face record budget deficits, federal budget deficits in recent years. Our national debt stands now, I'm told, at something just over $15 trillion, well over double what it was just a decade ago. The last time the debt was this high, I think, was at the end of World War II. That level of debt was not sustainable then, and it's not sustainable now. I believe I talk a lot about the cultures that we have here in Washington, and suggest that what we ought to do is establish a different kind of a culture when it comes to spending. A lot of people think we have a culture of spendthrift around here, and that we should replace it with a culture of thrift. I agree. I'm sure you do, too. I think we need to look in every nook and cranny of federal government, including domestic spending, defense, entitlements, tax expenditures, and we need to ask this question. Is it possible to get a better result for less money, or is it possible to get a better result for the same amount of money? And if it is, let's do that. Let's do what works. Figure out what works and, frankly, do more of that. But in order to be effective in the important work of identifying areas where we can spend taxpayers' money more effectively, we need to sharpen our pencils. We just stop making the kind of expensive, avoidable mistakes that lead to improper payments. Before going any further, I want to take just a moment, if I could, to explain what it means for federal agencies to make improper payments. An improper payment occurs, as you know, when an agency pays a vendor for something it did not receive, or maybe even pays twice for what it didn't receive. It can occur when a recipient has died and is no longer eligible for payment, or when a vendor owes the government money and legally should not be getting a payment until the debt is repaid. And, of course, sometimes people or companies receive payments that are actually fraudulent. Federal agencies have estimated, as you have noted, improper payments at levels of more than $100 billion annually during the past few years. Whenever I talk to people out on the stump from my state around the country about one of the keys to reducing the deficit is to address improper payments, their eyes kind of glaze over when I say the words improper payments, until I tell them how much they were. Until I say, well, did you know improper payments were about $121 billion last year? 121. And that gets people's attention. But those payments come from over 70 programs and more than 20 agencies, include programs like Medicare, like Medicaid, civilian and military pay at the Department of Defense, and at FEMA, to name just a few. And clearly, this level of inaccuracy, particularly as the federal government struggles with our massive debt and deficit, is unacceptable. But fortunately, we can do something about it. And if truth be known, we already are. And we're beginning to make some progress, too. A lot more is needed. I want to just take a moment just to say there's some folks sitting behind me, I think, from GIO. I just want to thank them for just being great partners with us and with all of us in trying to identify areas we're in danger of wasting a lot of taxpayers' money. And I want to give OMB a whole lot of credit. And the last administration under President Bush, they said, we've got a problem here with improper payments. We should do something about it, and got us started on this path. And this administration, to their credit, has pushed it hard, and OMB has been very supportive of our efforts. But there are several additional and effective tools available to curb wasteful and fraudulent payments. Today, I just want to outline a couple of steps that Congress can take now that will make an even bigger dent in improper payments and help get our federal spending back on track. According to GAO, the federal government has made an estimated $121 billion in improper payments in fiscal year 2010. I was encouraged to learn that the early data for fiscal year 2011 shows a slight drop in the level of improper payments of approximately $115 billion, even though more agencies have begun reporting their improper payments. For example, 2011 estimates include something that 2010 did not, and that is improper payments for the Medicare prescription drug program for the first time. And even though that's included, we've still seen, apparently, improper payments drop from 2010 to 2011 by about $6 billion. That's a lot of money. That's twice the budget of the state of Delaware in a single year. But having said that, error rates and the amount of money lost to avoidable errors still remain at unacceptably high levels. And while agencies are beginning to make progress in implementing new anti-waste and fraud controls and procedures, I believe that a lot more work needs to be done to identify, recover, and prevent improper payments. I like to say, if it isn't perfect, make it better. We're still running improper payments of $115 billion. It ain't perfect, and we can all working together make it better. But what disturbs me about the problem here in the Federal Government is that we seem to make these kinds of mistakes at a rate much higher than a business or the average family would tolerate or could afford, and we keep making them over and over again. Having said that, we're making some progress in improper payments, as I noted earlier. In 2010, you may recall, Congress passed, President Obama signed into law, the Improper Payments Elimination and Recovery Act. It's really a bipartisan bill. Senator Coburn, our old colleague here, Dr. Coburn, and I collaborated on it, had a lot of bipartisan support in passing it. This new law aimed at making agencies and agency leadership far more accountable for the expensive mistakes that they make. And again, it represents bipartisan, bicameral progress in an important area. The 2010 law basically does four things. First, it says Federal agencies across the board, you got to report improper payments. Second, you got to stop making them. Third, we want you to go out and, where it's feasible, where it's practical, go out and recover the monies that have been improperly paid. And number four, we call for agency managers to be evaluated, at least in part, by how well they comply with this new law. A wide variety of ideas have been put forward on how to further curb improper payments and, in the progress, reduce our budget deficit and begin whittling down our debt as well. For example, recognizing that more than half of all Federal improper payment estimates are from Medicare and Medicaid programs, last year, that same guy, Coburn, again, Senator Tom Coburn and I teamed up to introduce legislation to curb waste and fraud in both of those programs, both Medicare and Medicaid. The bipartisan legislation is S-1251. Put a long name here. It's the Medicare and Medicaid Fighting Fraud and Abuse to Save Taxpayer Dollars Act. Would take a series of common sense steps to identify and prevent fraud and waste in Medicare and Medicaid. It drills down into specific waste and fraud challenges within health care, such as physician identity theft, the need for improved fraud data sharing between Federal government and State agencies, and quicker identification of improper payments to medical providers. Our bipartisan legislation has now attracted 33 co-sponsors, a third of the Senate. Bipartisan. There's now a companion bill in the House led by Congressman Peter Roskam and another congressman, I think his name is Carney. He's from Delaware. My colleague and friend, John Carney. Our legislation has garnered the support of a wide range of organizations, including the National Taxpayers Union, Citizens Against Government Waste, and AARP. Not always names that you hear together in the same sentence. Most of the provisions of these bills are based on GAO's good work and NIG Inspector General recommendations. Well, today, let me just briefly focus on an important new measure that would help all Federal agencies prevent, detect, and recover improper payments. Bipartisan legislation that I co-authored with Senator Susan Collins, it's S-1409, the Improper Payments Elimination and Recovery Improvement Act, is now making its way through the U.S. Senate. This measure builds upon the 2010 improper payments law that Tom Coburn and I introduced and shepherded through. Our new bill recently passed by unanimous consent in the Homeland Security and Government Affairs Committee, and I'm hopeful it will soon see action on the floor of the U.S. Senate. You don't always see the word action and Senate in the same sentence, but hopefully we're going to see action and the Senate on this legislation as well. Well, let me now talk for a moment about a couple of provisions in the bill, and I'll close. Too often, Federal agencies make improper payments to individuals who could easily be identified as ineligible. Some of these individuals are applying for benefits using a false address. Others may not meet the criteria for eligibility. Let's take, for example, a person with a job applying for unemployment benefits using the name of someone who may actually be dead. Of course, those watching or listening to this hearing may ask the question, the obvious question of why would a Federal agency ever pay unemployment insurance benefits to an individual who has died or to someone who is trying to commit fraud? That's a good question. Unfortunately, the answer is that all too often, agencies simply don't do a very good job of coordinating their efforts to prevent improper payments or communicating about best practices. I like to, when I meet folks who have been married a long time, 50 or 60 or 70 years, I say to them, what's the secret for being married 50, 60 or 70 years? The best answers I've ever heard are the same. The two C's. The two C's, communicate and compromise. And what we need here is a lot better communication. Many of those agencies also have antiquated databases and computer systems for tracking basic payment information. And all too often, we simply don't allow agencies to access the information they need to avoid giving scarce taxpayer dollars to the wrong people. To their credit, the administration, through executive action, is establishing a Do Not Pay initiative. This effort involves screening recipients of federal funds against a list of those ineligible to receive those funds before we cut a check, for example, or make a payment. For example, before an agency could award a contract to a company, the agency would have to cross-check against the Do Not Pay database, which will include a central comprehensive database of companies and entities that are no longer allowed to do work with the Federal Government because of a fraud conviction or for some other reason. Our improper payments legislation establishes the Do Not Pay initiative in law throughout the Federal Government. We believe it makes several important improvements to the initiative and adds some tools and procedures to help agencies access data. The legislation also addresses what is called death fraud, and other improper payments to deceased individuals. In too many agencies pay benefits to individuals who are deceased and are therefore no longer eligible for payments under the program rules. For example, the Office of Personnel Management's Inspector General reported that $601 million in improper payments were made to Federal retirees found to have already died during the last 5 years, $600 million. However, such payments to dead people were not unique to one program. And last year, one of my home state newspapers reported that, get this, 28 years after a Delaware woman had died, one of her relatives was still pocketing, collecting, and cashing her Social Security checks. Improving the collection, the verification, and the use by Federal agencies of data on individuals who have died will help curb hundreds of millions, if not billions of dollars in improper payments. Our legislation requires that the Office of Management and Budget, in consultation with other agencies and stakeholders, identify specific solutions and report back to Congress 180 days after passage. The legislation also includes provisions that strengthen and make more consistent the methods used by agencies to estimate improper payments. And this has been an issue identified by both GAO and the Inspector General community. Finally, the bill establishes a series of recovery audit contracts to assure that agencies already recover, to ensure that agencies actually recover overpayments. Recovery audit contracting is already proven very successful in the private sector, as well as several Federal agencies, including within the Medicare program. There, in the Medicare program, we've witnessed recoveries of improperly spent taxpayer dollars approaching now $2 billion in recent years, and we expect those recoveries to continue to grow. It's kind of going like this. I anticipate that the Senate will look as favorably on S-1409 as it did on the Improper Payments Elimination Recovery Act. I want to invite the members of this panel and the House of Representatives to join us in this new effort by introducing a companion bill to S-1409, improving it where possible, and passing it. Let me conclude by noting that we're here today in large part because we believe we have a moral imperative to ensure that scarce resources we put into Federal programs are well spent. We must use every tool available to put our fiscal house back in order and to give the American people the government that they expect and that they deserve. It's the right thing to do on behalf of the taxpayers of this country who entrust us with their hard-earned money. And by working together on this latest in a series of common sense initiatives, I believe we can take another important step toward earning their trust once again. Thank you.
Senator, thank you for a well-stated kind of synopsis of the challenges before us and progress we have made, but what we yet need to do as your legislation proposes, and we certainly do look forward to working with you. A couple of the points you made, I certainly appreciate. One, it's always good to be able to kind of poke fun at ourselves, and your reference to action in the Senate in the same sentence is appreciated. On the House side, we sometimes share that sentiment that we're looking.
I have sat in your seat.
Exactly. But I would say personally, of all the points you made, as one who will celebrate 22 years of marriage this summer, and looking to hit 50 and 60 and beyond, compromise and communication, both in marriage and in government, are necessary for success. So I think very important message for all of us here in Washington to maybe keep things simple. What works at home in our marriages can work here and how we govern. So, but I know I speak for the ranking member as well, and the members of this committee, in saying we do look forward to a partnership between the House and Senate, bicameral, bipartisan, just to do right by the American people. And we're grateful for your efforts here today to share your insights.
I appreciate it. Just and a closing word. These are a couple of our ideas that we want to share with you. And they're not just Democrat ideas, they're not just Republican ideas. They're just, I think, they're smart ideas. Yep. And y'all have a lot of good ones over here. And one of the things that we need to do, I know you're going to be here for one more year. This is your last year, and you'll be stepping down and sailing off into the sunrise. No. But with your bride of 23 years, probably by then. But I just want to say, when y'all have good ideas, and I know you do every day, we just need to do a better job of sharing those ideas with us and communicating better to say, what do you think of this? Let's see if we can work on this together. And let's do that in the instances of the stuff I've talked about, and frankly, some really good stuff that you have for us to pay more attention to. And we would love to do that.
We'll look forward to it. Thank you again for being with us.
Thank you both. All right.
And we'll take a brief recess while we reset for the second panel. Hearing will reconvene, and as we were honored to have Senator Carper with us and his insights and commitment to good government issues, and especially fiscal responsibility. We're also delighted and honored to have our next panel. We welcome all three of you here and appreciate your willingness to share your expertise with us. The Honorable Daniel Werfel serves as Controller for the Office of Federal Financial Management at the Office of Management and Budget. Mr. Mike Wood, Executive Director of the Recovery, Accountability, and Transparency Board, and Ms. Meryl Davis, Director of Financial Management and Assurance at the Government Accountability Office. We, again, appreciate not just here today in your testimony, but day in, day out the work that each of you are doing to serve our fellow citizens and well protect the hard-earned tax dollars of all Americans. Pursuant to committee rules, now that you're seated, if I could ask you to stand so we could swear you in. If you raise your right hand, and do you solemnly swear or affirm that the testimony you're about to give this committee will be the truth, the whole truth, and nothing but the truth? So let the record reflect that all witnesses affirmed the oath. We will please be seated and we have had a chance to review your written testimony, and if you can try to keep your initial statement here today to about 5 minutes. If you need to go over some, we're not going to be sticklers too much for that, but we do want to save time for Q&A and have a more engaged discussion with you as we can, time allowing. So with that, Mr. Werfel, if you'd like to begin.
Thank you, Chairman Platts, Ranking Member Towns, and distinguished members of the subcommittee for inviting me to discuss the Federal Government's efforts in preventing, reducing, and recapturing improper payments. We can all agree that improper payments degrade the integrity of programs and compromise taxpayers' trust in their government. In fact, combating improper payments has been a leading priority of the administration's campaign to cut waste. Our intensive efforts to reduce improper payments are guided by the President's bold goals and by key reform ingredients such as transparency, accountability, collaboration, and innovation. These efforts are producing real results. We are on track to meet or exceed the bold goals set by the President, having decreased the government-wide error rate sharply from 5.4% in 2009 to 4.7% in 2011, and by doing so, avoided making more than $20 billion in improper payments over the last 2 years. We've also nearly met the President's goal to recapture $2 billion in overpayments to contractors. Today, I would like to quickly highlight 3 important initiatives that anchor our efforts. First, the 2009 Executive Order on Reducing Improper Payments. We have made great strides in implementing this executive order by identifying agencies with high error programs that account for the majority of the amount of improper payments, establishing supplemental measures to provide more frequent and current measurements for the majority of these high error programs, and selecting accountable officials responsible for coordinating agency efforts to reduce improper payments. All of this information is transparent and readily available to the public at paymentAccuracy.gov. Second, the implementation of the Improper Payments Elimination Recovery Act of 2010, or IPERA. Last year, OMB released guidance to agencies on implementing IPERA to ensure that they are properly assessing risk in their programs, measuring and reporting improper payments, and establishing corrective action plans and reduction targets. IPERA also expanded the agency's authorities and requirements for recapturing overpayments and created sanctions for agencies that are found non-compliant with the law by their Inspector General. Third, the implementation of the Do Not Pay solution. In June 2010, the President directed the establishment of a single point of entry where agencies could access relevant data before determining eligibility for a payment or award, and thereby avoid paying ineligible recipients. In addition to this memorandum, the Government Accountability and Transparency Board recently recommended that OMB work with agencies and the Recovery, Accountability and Transparency Board to create a centralized accountability framework that all agencies can use to prevent waste, fraud, and abuse. In response, the Department of Treasury has established the Go Verify Business Center, a single entry point that agencies can access to determine eligibility information prior to making an award or payment. The Go Verify Business Center is comprised of two components. One component is the Go Verify portal, a web-based single-entry access portal that assists efforts to prevent improper payments by enabling agencies to access data sources in a centralized location. The other component is the Go Verify Data Analytics Services, a resource that provides advanced data analytics to identify trends, risks, and patterns of behavior that may lead to further investigation on the part of the agency. When the President took office, improper payments were on the rise. Today, based on efforts underway and the collaborative work of the Administration and Congress, we are on track to meet or exceed the President's goals to cut improper payments by $50 billion and recapture $2 billion in overpayments to contractors by the end of this fiscal year. We have seen error rate reductions in almost every major program with a history of significant errors, including Medicare, Medicaid, SNAP, rental housing, the Earned Income Tax Credit, Pell Grants, and supplemental security income. As I referenced earlier, without these declines, the government would have made over $20 billion in additional improper payments in 2010 and 2011 combined. The Administration will continue to work through the Campaign to Cut Waste to reinforce a sense of responsibility and accountability for taxpayer dollars and make clear that no amount of waste in our Federal programs is acceptable. Thank you again for inviting me to testify. I look forward to answering your questions.
Thank you, Mr. Werfel. Mr. Wood.
Thank you, Mr. Chairman and distinguished members of the committee. Thank you for being able to appear before you today to talk about this important matter and potential solutions to reduce improper payments based on work done by the Recovery Board. The American Recovery and Reinvestment Act of 2009 created the Recovery, Accountability, and Transparency Board, tasked in part with preventing fraud, waste, and abuse of recovery funds. Last summer, the President issued an executive order calling for the creation of the Government Accountability and Transparency, or GAP Board, to make recommendations based on lessons learned from the Recovery Act, implementation of the Board's successes applying these approaches across government spending. At the same time, Congressman Issa and Senator Warner introduced legislation, the Data Act, that, among other things, would create a new independent agency, the Federal Accountability and Spending Transparency Board, to provide accountability and transparency for federally funded activities. Even before the creation of the GAP Board and the Data Act, the Recovery Board realized key lessons, that transparency drives accountability, and that the tools we have built for these dual purposes have proved useful from both a program and an oversight perspective. Along with Recovery.gov, the Board has received wide acclaim for building our Recovery Operations Center, or ROC, which combines traditional law enforcement analysis with sophisticated software tools, government databases, and open-source information to identify high-risk recipients. This accountability solution provides an in-depth fraud analysis capability to identify non-obvious relationships between parties and provide a predictive analysis model useful in focusing limited government oversight resources. The Board is now conducting pilots on a fraud prevention tools with agency personnel as well as with offices of inspectors general via the Board's new federalaccountability.gov web portal. This framework has the potential to open the ROC tools and approaches more fully to investigators and practitioners throughout the Federal Government. Our goals are to help agencies in performing their own risk evaluations before awarding Federal funds, and to help enforcement officials conduct reviews in order to prevent and detect fraud, waste, and abuse in Federal spending. Pilots with agencies, procurement, grant, and financial officials just began. With our expanded 2012 appropriation language, Congress provided some flexibility for us to develop and test new applications on non-recovery funds, and we plan on broadening the scope of these pilots. Fast Alert, a new application within the Federal Accountability.gov framework, provides awarding officials with the ability to quickly assess risk factors associated with entities that seek or have received Federal funds. The Board feels Fast Alert can be applied to all Federal spending from pre-award to the payment phases. Our work on federalaccountability.gov and Fast Alert is in keeping with the GAP Board's December report to the President, which noted the ROC has been instrumental in keeping fraudulent actors from attacking recovery programs, using cutting-edge forensic technology to protect taxpayer interests. This technology has applications across the government, and that is why the GAP Board recommends that agencies work together to create centralized framework that leverages the ROC and similar technologies, allowing us to share data and coordinate our efforts to detect and prevent fraud. It's also in keeping, I think, with the internal control guidance established by OMB for improper payments that cited our lessons learned as well and came to a similar conclusion. Payments resulting from fraudulent activity are only a subset of the wider problem of improper payments. However, the Board's tools would assist in identifying questionable entities in the preventive pre-award phase and as a review prior to payment. In consultation with OMB and the Department of Treasury, we have incorporated features like batch searches and program-specific databases to better meet agency needs. Realizing full implementation of Fast Alert is complicated by some common problems that Congress, agencies, and executive leaderships must solve. The computer matching provisions of the Privacy Act may restrain oversight activities, a problem that is solved by the Data Act. True data management also requires that government standardize data and provide more modern open access to databases. Agencies are often reluctant to share databases due to a fear of violating the Privacy Act, leaving inadequacies in payment and awarding tools. We have the technology and know-how, and with your help, and the governance, access, and data issues can swiftly be solved. That concludes my prepared remarks, and I'd be happy to answer any questions.
Thank you, Mr. Wood. Ms. Davis.
Chairman Platts, Ranking Member Towns, and members of the subcommittee, thank you for the opportunity to be here today to discuss improper payments in Federal programs. My testimony will cover agencies' reported progress in estimating and in reducing improper payments, the challenges ahead of us, and how to move forward in improper payment reduction strategies. An improper payment is any payment that was made incorrectly in the wrong amount. It includes underpayments as well as overpayments. Also, it includes payments that lack sufficient documentation. Progress is being reported by Federal agencies in both estimating and in reducing improper payments. In fiscal year 2011, Federal agencies estimated improper payments of $115.3 billion, as noted by Chairman Platts, a decrease of $5.3 billion from that of the previous year. This figure is about 4.7% of the $2.5 trillion in total spending, as noted by Ranking Member Towns. The estimate was attributable to 79 programs spread across 17 agencies. The 10 programs with the highest dollar amounts accounted for about $107 billion, or 93% of the total of improper payments. The 10 programs with the highest rates of improper payments had rates that range from 11% to over 28%. Although progress has been reported, the Federal Government continues to face challenges in determining the full extent of improper payments. Some agencies have not yet reported estimates for their risk-susceptible programs. In addition, internal control weaknesses continue to exist that heighten the risk of improper payments occurring. Estimating methodologies need to be developed. For example, there are 2 DoD programs related to commercial payments where the estimating methodology is still being developed, and for this reason, the programs could not be included in the government-wide estimate for this year. Given the amount of Federal dollars that are flowing into these risk-susceptible programs, it's really critical to enhance our efforts to improve and reduce improper payments. Continuing and expanding activities are needed to move forward in the following 3 reduction areas. First, identifying and analyzing root causes of improper payments. Second, implementing effective controls that would prevent improper payments in the first place. And then third, implementing effective detection controls that would identify and recover improper payments. Regarding the root causes, identifying and analyzing the root causes of improper payments is key to developing effective preventive and corrective action plans. Beginning in fiscal year 2011, agencies were required by the Office of Management and Budget to categorize their root causes into 3 different categories. We found that only about half of the 79 programs with improper payment estimates were actually using those 3 root cause categories. Now, without detailed and specific information, agencies are really hampered in their ability to take actions to prevent and to reduce improper payments. Regarding preventive controls, strong preventive controls serve as the frontline defense against improper payments, and many agencies are in the process of implementing those controls. Preventive controls involve a variety of activities such as upfront validation of eligibility through data sharing and predictive analytic tests that can identify patterns of potential risk for fraud. Addressing program design issues is another preventive strategy. For instance, agencies may explore whether complex and inconsistent program designs could actually contribute to improper payments. Effective strategies for reducing improper payments may actually call for streamlining and for redesigning or changing those program requirements. Finally, regarding detective controls, agencies need effective detective techniques to identify quickly and to recover improper payments that actually result in losses to the government. Recovery auditing, such as that used in the Medicare program, is an example of identifying contractor overpayments. Detection activities play a significant role not only in identifying improper payments, but also in determining and highlighting those areas where there is a need to enhance our preventive controls. Chairman Platts and Ranking Member Towns, that concludes my prepared statement. I would be happy to answer any questions you may have.
Okay. Thank you, Ms. Davis. We will go to questions. We're glad to be joined by the gentleman from Virginia, Mr. Connolly. And before we go to questions, did you want to make any brief statement?
Mr. Chairman, I thank you so much for your indulgence. And I have two other hearings at the same time, and I'm the ranking member on one of them. So, but I wanted to come because I want to, first of all, thank you for your leadership and yours, Mr. Towns, on this important subject. You know, here we were sweating in the so-called Subcommittee to try to identify $1.2 trillion over 10 years. Here we have improper payments that are $125 billion plus every year, which would exceed actually the goal of the Subcommittee if somehow we could get it to zero. Now, we're never going to get it to zero. But it seems to me that one of our goals in this subcommittee and in pursuing this subject is to how do we put in place processes that push us toward that goal. And in doing so, we make a very substantial contribution to debt reduction and to getting our federal spending under control without having to take a meat axe to substantive investments that matter to the country. So I just think this is one of the most promising endeavors of the entire committee, Mr. Chairman, and I thank you again for your leadership, and I thank our panelists for being here. Please forgive me when I have to duck out to return to my primary subcommittee.
Appreciate the gentleman making the effort to be here and his words regarding this issue. And as we conveyed to Senator Carper in his testimony, the bicameral, bipartisan effort to focus on this issue. And as you well state, if we were successful, we would more than exceed the $1.2 trillion that we were after in the Supercommittee. So I will yield myself 5 minutes now for the purpose of questions. Certainly thank each of you for what you're doing every day to help prevent improper payments as well as the overall, good fiscal management of the federal government. I do want to acknowledge very much so the efforts of this administration and the number of initiatives, and Mr. Warfel, you've highlighted them well. I do want to caution in how we use numbers and statistics when we talk about $20 billion towards the $50 billion goal, that's a guesstimate because of the percent went down, that therefore we avoided $20 billion. We really don't know if we did or not. We're just applying a percentage of 5.4% in 09 to today at 4.7, and perhaps we saved. We don't really know for certain if that is an accurate number, and because if we take that approach, we would also have to acknowledge that we also know that improper payments that have not been identified went up, because DOD being the biggest culprit here of not being able to properly identify improper payments, their budget is higher today than it was in 09. Therefore, there's more money that's not being properly identified to prevent improper payments. So I think just a caution there, but it's a specific concern as we look at the numbers, because they do give us guidance of are we making, having success, are we, taking strides in the right direction, and specifically with the Department of Health and Human Services. The biggest, challenges are Medicare and Medicaid. As we've heard, about half or a little over half of all improper payments identified are those programs in that department. It's my understanding that there has been a change in the methodology and what they consider an improper payment within the Department of Health and Human Services, and specifically that if they identify an improper payments and recover it, that then it's not counted as an improper payment because they actually, got the money or, prevented it in some way. Is that your understanding and your thoughts on that, if that's the case?
Thank you for the question, Chairman. Actually, the HHS methodology fix is as follows. What they determined was there is a paperwork process that they go through once they sample a payment to determine whether it was accurate or not. And all that paperwork doesn't come in all at the same time. It takes time to investigate the accuracy of the payment. What happens is at the point in time in which they have to put their pencils down and do their error measurement, they still have paperwork outstanding, and they haven't fully addressed whether the error is an error or not. And historically, for any area where they had to put their pencils down because they were out of time and it was time to do their annual report, they counted everything that didn't get the full paperwork on as an error. And they've been looking at this for a few years and in consultation with their Inspector General thought perhaps we are overstating our errors by doing this, because they started looking at historical numbers and later on, so they put their pencils down, let's say on November 15th, so that they can issue their audit reports. On December 1st or December 15th, the paperwork comes in and they get the answer in full in terms of whether the error was an error or not. And what they determined was they could go back and look at historical records and say, based on historical records, there's a certain percentage of that paperwork over time that actually comes in and it's not an error versus it is an error. And so what they decided to do, what they thought was a more fair presentation of their error, was to adjust their error rate based on historical numbers that dictate, well, if we've got, let's say we've got 10 paperwork that are outstanding. Historically, 3 of those are errors and 7 of those turn out to be accurate. And that's true for years. So we are going to apply that percentage for the paperwork outstanding this year for the error. And that's the change that they made. And believe me, Chairman, we would have not been comfortable with the change if the Inspector General hadn't endorsed it. The Inspector General agreed that it was a fair presentation, and that's why the change was made.
So, and there is nothing where, even if they identify something up front, not question where they put their pencil down, but if they identify a payment that was made improperly, that they recovered it, that it's no longer counted as an improper payment. You're not aware of? I'm
not aware of that. And there are certain isolated incidences that I am aware of where an agency makes a payment and can subsequently discount their error rate by a quick recapture of that amount. That takes place, for example, in Social Security, and in many ways we allowed that within the methodology because under the law and regulations they're compelled to make the payment even when they know it's wrong because the due process hasn't been complete. And so for those where they know they're about to make a payment that they believe is an error but they're compelled to, and then they can get the due process done and quickly pull it back, we've discounted those. But I'm not aware of the situation occurring in HHS.
That, and I'm hoping that's accurate across the board, because that would defeat our goal here, which is identify why are we making improper payments, because that ultimately is how we prevent them in the future. One second question before I yield quickly here is certainly glad with Part D now being part of the analysis, the first year that the prescription drug program is now being looked at. But CHIP and TANF are 2 that are not. And I know there's 2 issues here with TANF. It's state partners and more challenging. And then with CHIP, it's, I think, statutory of when they could start looking at error rates. If you or other witnesses could comment on what should we expect with TANF and CHIP, if is there a guesstimate of what their error rates are likely to be, and what's that going to do to the numbers? And maybe we can't because we don't have good enough data, but if any of you could comment on that, that would be helpful.
We've had, there are different data points that we could possibly share with you. I'm not sure I have them at my fingertips, where the agencies in particular on TANF has gone out and done a measurement. What happened with TANF is that we had there's a lot of legal questions that have not yet been resolved in terms of the ability of HHS when the program converted from AFDC to TANF, there were certain restrictions placed on or alleged restrictions on what the agency could do to audit payments. As a result, I think it was about 5 or 6 years ago, the IG used its enforcement and investigative authority to go down and do the measurement themselves, which is unusual. Typically, in all other situations that I'm aware of, the agency does the measurement and the IG evaluates the sufficiency of the measurements and whether the necessary corrective actions are taking place. So because the IG went ahead and did that, we got some insight into some of the error. I think they did an error measurement in about 3 states. And so we learned that, yes, what we found that there were significant errors in TANF when that study was done. There were very, very important perspectives that were coming from the state government challenging the HHS's IG methodology. So there's a lot to sort through there, but I agree completely that until we have a measurement on TANF, our overall measurement is incomplete. I just don't know that we, without Congress's help, have a path forward on that particular program.
Well, and I think that's an important point here. If as you and the IGs, work through that issue, if there is a legislative barrier that we need to take a look at, that's something that we welcome that information to how to partner with you. Yep. Mr. Wood or Ms. Davis? No? Okay. I'll yield to the gentleman from New York for purpose of questions.
Thank you very much, Mr. Chairman. Let me ask you, Ms. Davis, in your testimony, you state that identifying and analyzing the root causes of improper payments is the key to developing corrective actions to reduce and prevent improper payments. And of course, what has GAO identified as the main root causes of improper payments among federal agencies?
That's a good question. There are many answers to that. It would be difficult to put everything into one specific category. As you know, there are 3 different categories that have been established by OMB: documentation and administrative, authentication and medical necessity, and verification errors. That and the compliance is about 50% as far as reported agencies or agencies reporting that they have identified root causes within those. I can give an example that I think might be helpful to you. For example, the Department of Labor's unemployment insurance program, they have determined that most of the errors there are due to people who have actually gone back to work and are still continuing to collect benefits. Now, just as an information point, the Department of Labor has been working with HHS, who has a do not hire database, and they are looking at that database to help them, assist them in determining when people actually go back to work. There are many, many reasons. Many of them administrative errors. The issues that are presented have been categorized into those 3 different areas. We noted that the explanations were in all 3 areas when we received information from the different agencies. But the first area, the documentation and administrative area, seemed to have the highest recurrence or frequency of reasons for root cause information.
Right. Senator Carper said something that has really bothered me. He indicated that an example of a person that had expired, and for 20-some years later, they were still receiving his or her Social Security money. Now, I know it's to be the obligation of the family to report, but is there any way that we can connect with the funeral director and require some responsibility there in terms of from a legislative standpoint? Because it seems to me that should be something easy to fix. If a person expires, then the funeral director would indicate to that this person is no longer with us, and so therefore no further payments should be made. I mean, does this make sense? And I'm trying to get my arms around what we can do to cut down on the numbers, because they still seem to be very big. Yes, anybody?
I agree, Congressman. This is an area that we've delved into very closely after the President directed the creation of the Do Not Pay list, because in that memorandum, the President specifically called out the Social Security Death Master File as a data set that we need to make sure that we're checking more robustly to prevent these payments. The challenge comes from imperfect information. There's a couple of challenges here. There's imperfect information in the Death Master File. The Social Security Administration has tried a variety of different efforts to improve the timely and accuracy of that database, including working in some cases with states on programs to get funeral directors to report in information more frequently. There's other mechanisms at play that can improve that, but it remains an imperfect database, and that can be part of the problem. The other challenge here, and this is something that I think Congress can help us think about very closely, is the access to the Social Security Death Master File and all these various databases are not seamless. There are I believe legitimate but challenging legal barriers to accessing, for an agency to access information, whether it's the Privacy Act or data security issues. So even if we get a fully robust and timely, complete Death Master File, which is a challenge that we're working towards and Social Security is working on with us, the next hurdle is making sure that the agencies have real-time access to that data, because the 20-year example is egregious and we need to stop that. The higher risk is the more recent death situation where we didn't get the data, the payment went out, and I think that's the higher probability of where we're going to make an error, and to close, and that's where more of the improper payments are. To close that particular gap, we need to make sure that we're getting access to data. So we need to figure out good solutions to some of these legal issues, because the Privacy Act and the data security, all those issues are legitimate. We just need to figure out if there's a way to get agencies access to that information quicker while still protecting those other important interests.
I'll yield myself time again, and really one is a follow-up on Mr. Towns' question and the discussion about the reporting of root causes and the failure by the majority in dollar amount of the improper payments did not come along with the proper identification of the root causes. Actually, let me find my spot here. In the Improper Payments Act of 2010, it created sanctions for agencies that do not properly comply with the law. And I think that goes to the issue of not properly reporting the root causes of improper payments. And in fact, HHS, which again has the majority of these improper payments, their auditors said that for the 8th year in a row now, they failed to comply with the original Improper Improvements Act of 2002. So I guess first, Mr. Werfel, are you? I know that the Act of 2010 is a little over a year old, but what type of sanctions should we expect to see? And what, if any, are being pursued because of failure of agencies to not to fully comply?
The Improper Payments Elimination and Recovery Act, which was passed in July of 2010, I believe, for the first time changed the landscape on improper payments and added this concept of sanctions and increased accountability. And those are really triggered, I believe, on the Inspector General's review and their assessment, and based on the different type of noncompliance, which whether it's failure to report root cause or having an error rate that's too high, or whatever the issue is, or not reporting a program. For example, we discussed TANF in the HHS realm, that the IG will report in I think those reports are due, and with the enactment of IPERA, we're now kind of in that first phase of IG assessment, and those reports are due in mid-March. So at that time, we'll have a good sense of what the landscape of noncompliance is, and then the statute will trigger a variety of different repercussions, such as special reports to Congress, requirements in terms of how discretionary funds are used to combat improper payments. This is something that we hope will help reinforce the importance of these things that are being non-complied with. It's something that we'll have to evaluate together to see if those sanctions are doing their job or we need to think differently and raise the stakes.
Do you see under the President's executive order, we created accountable officials? They kind of go hand in hand, with the law of trying to ensure compliance and make sure there isn't a reason for sanctions. Can you comment on how the administration sees the accountable officials working with the requirements for sanctions if there's not compliance?
Absolutely, Chairman. I mean, let me just start by saying I've had the privilege and the opportunity of being at OMB across the entire lifespan of the Improper Payments Initiative, starting with the passage of the IPIA in 2002 until today. And I believe firmly that this administration has set a new bar in terms of accountability. The President himself has been actively engaged on the issue. I've been in meetings where he has talked to Deputy Secretaries directly about his concern over this issue. The establishment of the senior accountable official is a part of the blend of different things that the administration is doing on a whole variety of management improvements, and I think we need to look at a broader picture from the HHS perspective. You mentioned that half our balance sheet is HHS for these improper payments, and there is a tremendous footprint of work going on at HHS right now. It is a major top priority. I mentioned the President. The Vice President is also interested in this. The Vice President is now holding quarterly cabinet meetings on waste, and improper payments is a central theme of those meetings. I think in 2 of those meetings, Secretary Sebelius has presented to the Vice President on HHS efforts. This is at the very highest level.
Yeah.
And I will point out that I think it's important to note that while there are areas that HHS needs to improve upon, and when you take a step back and you look at the amount of improper payments that HHS makes, it's staggering. But at the same time, the major programs in HHS, all the parts of Medicare and Medicaid, those error rates are declining and have declined several years in a row. So that's a really important trend. It demonstrates that the agency effort is having an impact. But as everyone in this hearing has so far noted, there's a lot more work to be done. But I think the trend is positive.
Well, and if you use the Part D as kind of the newest program, major program to come online, I think a little over a 3% error rate versus over 8% for Medicare and Medicaid. Hopefully, I'm hoping that means that since it's a new program, we're getting it right up front as opposed to trying to correct problems, with Medicare and Medicaid down the road after the fact.
Yeah, I would say that the department is much more focused and has much more resources that they're bringing to bear on improper payments at the birth of Part D than they did at the birth of the other programs, and I think that's why one of the reasons why you're seeing a Part D error rate that's lower than the other programs. Yeah,
and hopefully that continues. Before I yield, Mr. Towns, all 3 of you, I think you all had a chance to hear Senator Carper's testimony, familiar with his legislation. With maybe not fair to ask without him here to respond, but what do you think is most important in his bill that we should be looking at, or is there anything that concerns you in a broad sense? And then, Ms. Werfel, maybe for you specifically, the do not pay part of his bill. Do you think it aligns with what he's proposing legislatively, what the administration is already seeking to do, or is there something that we should be aware of, the groundwork that's already been laid, that we don't undo it legislatively by taking a different approach? So, but maybe I'll start with Mr. Wood and Ms. Davis, and then Ms. Werfel will finish with you, and the broad pros, cons of the bill, and then specifically the do not pay part for Mr. Werfel. Yes.
Thank you, Mr. Chairman, and I'd touch on the do not pay as well, because we've been doing some work, I think, in that related area at the Recovery Board. I think it's a strong bill, and I think it, improves the methodology for collecting this data. As Mr. Werfel said, the data is not always perfect. We seem to be moving in a direction to get that. One of my concerns at the board, our tools are focused more on prevention and oversight. That's what we've been doing with the Recovery Act. We've done a fairly good job on that. We've talked to both OMB, GAO, and the Treasury Department, who's building this Go Verify system, about our technology and their technology. I think the issues you run into in do not pay, my concern in the do not pay area would be being too prescriptive in what do you have to look at for do not pay. It's at the board, we take a sort of a broader approach. We've got a Recovery Operations Center. We have a system where you could run entities or individuals through it, come up with a list of people that would clear, and then take a closer look at people where you think there's problems, because there's a lot of false positives and so forth. And we've talked to Treasury about that, about our approach. They're still working, and Danny mentioned that it's difficult to get access to some of these databases. We're still working on getting all the databases that were listed in the executive order that talked about do not pay. So the one area I think that I'd be concerned about in looking at that from a technology standpoint and an oversight standpoint is being too prescriptive in here's the 3 things you will check. There's a lot of things you might check. For instance, in the Recovery Operations Center, one of our successes has been being able to look across government. You could look at things, for instance, these recovery audits, which are recouping payments. You could look at them across government, perhaps using non-structured data analysis, to find if there's trends and similarities where you might not expect them. DOD may collect some money that is very similar to what Social Security Administration is collecting, and for the same reasons, and it gets to the root cause analysis. So there's some technological approaches you could take that are interesting and sort of advanced, cutting-edge sort of things that you really don't want legislation tying your hands on any of that. And I don't think it does at this point, but that's one area that, in reviewing it, that I would mention.
And in essence, making it clear that if the legislation identifies certain databases to look at, that it's these
plus perhaps others, or
and
whatever
any other that are
necessary.
appropriate
Right.
or helpful.
And
So
the methodologies might go beyond just one check.
Yep. Okay. Ms. Davis?
Mr. Chairman, since GAO has not formally reviewed the bill, I cannot specifically comment. I can say that at a very high level, the intent of the bill for accountability, transparency purposes is certainly an admirable goal. I can also make a statement, and again, very generally, that some of the concepts in the bill, such as looking at high priority programs and data matching, comparing databases, are best practices that we've really talked about in many of our reports. But other than that, I really cannot comment. Thank you.
Okay, thank you. Mr. Werfel?
Yeah, similar to Ms. Davis, we have not run the appropriate process across the administration so that I could present to you an administration position. So I don't want to state anything that could be represented that way. I will say that on a general matter, and reinforcing my point earlier, that the number one barrier to success in the do not pay environment is going to be access to data. And I think that one of the most important things Congress can do to help on improper payments is to help us pull back the onion layer on these various databases and figure out how to navigate this important tension between privacy and security and the need to have this information to enforce program integrity outcomes. I think right now we haven't tackled the issue directly, and therefore every time we determine that access to a database is going to be helpful to drive down improper payments, we go through a very long and laborious process to try to figure out how to thread the needle and get the data in, and we're not serving the taxpayer effectively by taking it one at a time. So I think that's one of the most important things we can do as a community.
Yeah, we certainly saw that in our oversight hearings regarding the Internal Revenue Service and taxpayer identity fraud, and the challenge of access to the information, preventing that type of fraud from occurring. I understand you can't speak as far as administration position. As it's currently standing, are you aware of anything in the bill regarding the do not pay aspect of it that would undo the efforts that are underway currently by the administration regarding do not pay?
I'm not aware of anything that would undo. I think if I understand the bill correctly, its intent is to reinforce. Again, I would go back to this broader question of data access as the big issue that's going to help, accelerate and drive greater success outcomes. But I don't know of anything in the bill that undoes it.
Okay, thank you. Yield to the gentleman from New York, Mr. Towns.
Mr. Wood, can you explain what factors you use to predict whether a program is susceptible to fraud?
I don't know if I have a perfect explanation of that, but we do look at a whole series of factors. When we were doing the Recovery Act early on, we worked very closely with the various inspectors general and with the program officials and OMB to sort of come out with a list of what we considered high-risk programs, and that was based on a whole series of analysis, historical information, data we might have on hand, what type of spending it was going to be, and what it seems to be more subject, at least historically, to risk. Part of, and as Mr. Werfel keeps mentioning, part of our issue with the Federal Government is we don't have good historical data sets around some of these things. So we look at a whole series of things. We're building a product now called the Fraud Scorecard, which is very similar to something you might see in the FICA. Actually, the people who developed it are building it for us. And when we look at it, the difficulty we end up with is we don't have this good historical data set of bad actors. That kind of information just wasn't collected in a manner that would help us. Because what you do is you take, here's the people that did things incorrectly versus, okay, here's the people we knew did it correctly, and you build some factors where you could do that using technology. So we're at the board, we've combined both technology and just sort of common sense rules of thumb on what we see as high-risk areas, and that's what we're looking at. The board is looking at really identifying these high-risk areas and trying to initiate preventive measures, better internal controls, training, different checks on who you're giving money to, that type of thing. So we're doing that. There probably is not a good, if I could figure out a good set of characteristics for fraud, I'd probably be very wealthy.
We wouldn't need this. We wouldn't need this hearing, huh?
But yes, we could design a solution. So I hopefully that's helpful. We sort of look at a matrix of things. We've got at the board, we're lucky we have technology that we're able to apply that is very powerful as well. But that needs to be interpreted by humans.
Yeah.
So.
I guess the other thing is that, I noticed that that there's been 70 leads of possible fraudulent activity to various agencies. Now, will you be able to get results as to whether or not what you suspected really happened? I'm trying to figure in terms of the feedback mechanism.
Yes, there is, and we've actually just started an effort at the board to go out and work closer with the IGs to build that better feedback mechanism, that if we send information out, what's happening with that, and is it really actionable, and is it turning into cases? A lot of the cases, unfortunately, if it's a criminal matter, that could take a couple years. So we're fairly young in that regard. We've only been around for a few years. We've got a couple years before we sunset. So we are building a feedback loop. That's we've got a new chairman, Kathy Tai, who's come over to replace Earl Devaney, who had been there for the last few years, and that's one of the things that Kathy has been working on, is to try and get this feedback loop in place so we can answer those questions very specifically.
Right. Thank you very much. Mr. Werfel, people that are doing wrong sometimes, find different ways and methods to move on to continue to do wrong. What steps have been put in place to ensure that individuals and entities that are on the list do not simply create a new company or to continue their fraudulent activities by changing their name?
I think that's, that gets at what Mr. Wood was talking about as being the real game changer in terms of addressing error reduction. As you know, let's take since you brought it up, the excluded party list that GSA has of those that are suspended and debarred from receiving federal payments. If we just do a one-dimensional match, and let's say I'm about to pay 30 vendors, and I run a match against the GSA database, I could very well not see any of those 30 entities appear, assume none of them are suspended or debarred, and move forward. But as you point out, the reality may be that one of the entities that I'm about to pay was a suspended and debarred entity not a few years ago, but has reincorporated under a new name, and therefore is done so in a way that eludes our ability to make sure we stop that payment. In order to get at that, you've got to do two things. You've got to access a more detailed and robust set of data. You can't just rely on the simple unidimensional GSA list. You've got to now do some investigation outside of that list to understand the history of some of these companies, the relationship of some of these companies, and fortunately, where we are today in the information age, that type of information is available. And then, as Mr. Wood pointed out, you need human beings that know how to ask the questions of the data. It can't just simply be the technology doing the match. You've got to be smart enough to look for patterns and trends and profile some of this information to say, this is the type of company that we've seen before that's been reincorporated in a new name, and so we know exactly how to ask the data. It's not easy to do. I think the good news, Congressman Towns, is that because of the great work that's going on the Recovery Board, they've plowed new ground in terms of showing us the way, in terms of how to look at the data multidimensionally. And so when we're building our Go Verify Center, I mentioned earlier that that it's not just the technology, there's an analytics center. It's for this exact reason, because just the technology won't solve the problem. You need the analytics as well in order to stay ahead. And I think where you'd be pleased is if HHS was here talking about, for example, some of the work they're doing in fraud detection. They're asking these multidimensional questions that they didn't ask previously. They're starting to look and understand trends and patterns of behavior that they didn't once know about. And frankly, the Recovery Board helped them raise their game, because the Recovery Board did a pilot of their tool with HHS and showed them some new tricks and new ways of staying ahead of the fraudsters that are now being deployed at HHS. We're not where we need to be yet, but there's some promising directions taking place, and we're starting to have more robust approaches to fraud detection.
I know my time has expired, but I had sort of one quick question. I know you asked about the legislation, and of course I heard your response. But is there anything more that we need to do on this side of the aisle that might help you to be able to work much more effectively and to be able to solve some of the problems that you keep running into? Right down the board.
I mean, from my standpoint, there's a couple of key things. The last year's president's budget, for example, includes a series of program integrity proposals that we believe have a dramatic and important impact on improper payments that have been in budgets for years and have not been enacted for whatever reason. In some cases, it's investing in more reviewers and investigators, but that infrastructure that you're investing in has a return on investment, sometimes $11 for every dollar invested. Those are really, really important things that we need to be very careful if we're not going to make those investments in understanding the costs that we're bestowing on the taxpayer when we don't do that. There's also included in previous presidents' budgets legislative changes that provide tools, for example, to the Treasury Department or others that help us wield certain tools to help collect debt or enforce improper payments more effectively. Whenever I get asked that question, I always try to call attention to those remaining program integrity provisions that are not provided for. I'll reiterate, helping us crack this nut of data access, making sure that we can balance those policy tensions. And third is what you're doing today. I mean, these types of hearings, it's powerful and important for me to go back to the agencies and say, I was just up on Capitol Hill. They were demanding answers on improper payments. That empowers me to work with the community to make sure that they're dedicating the necessary resources to address the problem.
Mr. Wood. Thank you. Mr. Wood.
I'd second the item on data access to data sets. Anything that the Congress could do to alleviate some of the problems we run into because of the Privacy Act, and there is a tension. You don't want to release privacy information, but at the same time, the government needs to be able to match some of this data in a more easy way. I think the second piece related to data, anything you could do in your oversight role or in other legislation to push data quality and data standardization. What we're seeing when we have new tools that allow us to reach into some of these databases that are fairly antiquated and match data, but that's a difficult thing to do. There's a lot of people maintaining these databases, and if they would do it in a more standard way, if they would build them in a more modern way where you could get access to the data much easier than we do right today, that would be very beneficial, so we could share data much easier. Those would be my 2 points.
Thank you. Thank you. Thank you.
Congressman Towns, I would echo the earlier comments about the value of these hearings. I think that they show the transparency and the importance of this issue. So that would certainly be my first comment. My second comment might be looking very deeply at some of these program design issues to the extent that they might be affected by legislative barriers. And, Medicare is a very good example of how we have partnerships with the states, but it's very difficult because there are so many complex and inconsistent requirements among the states. So it creates difficulties and is certainly something that would affect improper payments. The other the area that I'll just say is working more closely with GAO as you have been doing. We have a number of projects currently in process. We have a couple of Medicare projects related indirectly to improper payments. We have 2 projects in Medicaid that are looking at improper payments. One of them specifically looking at CMS's estimating methodology. And those one is in the design phase, so it's very early. The other is expecting a report probably early this summer, maybe in the time period around June. We are looking at DOD, looking at a number of things related to improper payments there, along with some of their estimating methodologies, looking at the recovery audit program and regulations that are affecting improper payments. So we continue to do that, and we'd just be happy to continue to work with you in any way that we can on any issue related to improper payments.
Thank you very much, and thank you, Mr. Chairman, for your generosity. I know I went way over my time.
You and me both. Well, maybe a final comment, Ms. Wood, with those projects with Medicare and Medicaid, and Ms. Warfel, with your discussions as part of your testimony with HHS in a broad sense of the leadership of Secretary Sebelius and the commitment they're making. Something we may want to look at is a hearing that's specific to HHS programs that may include what GAO is looking at and allowing the Department to share what they're doing. Certainly that's important given the size of the improper payments that come with under that Department, but also what maybe they're doing that can then be beneficial across the federal government departments and agencies. So something maybe we can look at for maybe later this summer. It sounds like to have GAO participate with those projects would have to be a little later in the summer, but I think a good idea for us to look at. I do want to thank each of you again for your testimony, and as is always the case, we're very blessed by the knowledge and expertise that our witnesses bring to us. Ms. Warfel, you've been before us a good number of times over the years. I think probably both when Mr. Towns chaired as well as when I've chaired. To all of you, and especially Ms. Warfel, your leadership in these issues and the partnership you've had with this committee for a long time is appreciated. We're going to keep the record open if there's any other materials to be submitted for 2 weeks, or actually I guess we said 7 days, and look forward to continue to work with you on the macro sense as well as the micro, such as Senator Carper's legislative proposal as we go forward. So this hearing stands adjourned.